nothing that we want. Because, you know, everybody's great at getting what they want. When this nice man, this hot man gets sworn in, his whole family's going to be covered with the most amazing plan that can be on earth, because that's what those guys have. All the senators, all those. I want what you have. You want to give me what I want. You want me to have health care. Give me what you have.
You hear that, Senator
Give me what you have. Give everybody in this room. And this is not, I have to be clear, this is not to Mr. Brown. This is not to Mr. Brown. I'm saying, you know, I would like to have health care that I could depend on. I want that. Yeah, you think I have a lot of money? Yeah, but my insurance doesn't cover jack. Okay, doesn't cover jack. I go, they say, oh, no, that's not covered in it. So what?
Or no,
you know,
a lot of the doctors say we don't take health.
We don't take it. I want what all of those guys and gals in Washington who make the decisions, who are going to decide whether we should get something, I want to get what they got. Then we don't have to talk about it.
But even with us, we have, those of us who are fortunate to have insurance, and our insurance, like you said, it doesn't cover jack. There are some people out there, there's a single mom with 2 kids who has nothing, a family who works a couple jobs. They have nothing. They want something.
Well, I think American people have health insurance and they're happy with it. But it's like one of these, I got mine, you know.
Here's a solution, too. I mean, for instance, Tim and I both qualify for insurance. We should be able to maybe slot one of those over to someone who doesn't have insurance necessarily. Because what happens is when a couple has insurance and they're double covered, what the insurance companies do is with the bill. They go back and forth on who's going to pay it. I should be able to allot one of those to someone who maybe needs insurance.
But it shouldn't be a mandate. Carry your ex-husband for a bunch of years on your insurance, too. I don't know about that. Slot nothing over.
The thing about health insurance, if this doesn't go through at all, if we get nothing, then we're never going to solve the issue of whether a person has a pre-existing condition and how that person is not allowed to get health insurance.
It shouldn't go around this way. This is almost criminal what's happening, Joy. It's almost criminal.
They're obliterating anything at this point. And this guy coming in could be the death knell, of the entire thing.
He's going to save it. What's happening is not American. Finally, the American people spoke up and said, you know what, I'm not about a mandate, and I'm not about sneaky politics.
But never has any kind of policy.
Put Obama in, remember that?
Even with
now
Reagan, with the senior Bush, with the junior Bush, nobody has ever tried to do a health care for some people.
Give me what you got. Give me what you got. It may not happen, but you know what? If enough people get pissed off enough and say, wait a minute, Mr. Congressman, Mr. Senator, why do you get, what makes you better than me? As a person, I work just like you work. I work every day. I pay my taxes. I do everything. Why can't I have what you have?
The Republicans will tell you that will bankrupt the system, and that's why you're not going to get it.
What about the fact? Why doesn't it intimidate you to hand the government one more thing? All I heard last time around was how the government messed up Katrina. They messed up the war. The government does not step up enough.
Yeah, but they also messed up deregulation, and look where we are too.
Tell me when your house is on fire and you're getting mugged, how much the government helps you.
You know what? This is why mandates happen. That's why people now are speaking up. You know, everybody bitched that Bush didn't do a damn thing. Everybody bitched that Bush didn't do anything. Now, we got somebody who's overdoing stuff, and everybody's mad about that. We are just, give me what you got.